Hello everyone, today we are going to learn about liver function tests. Okay, LFTs are a panel of routine biochemical tests that are performed to diagnose and manage liver diseases, right? So first point which you need to know is that only 20% of liver tissue can carry out the whole normal functioning of the liver. Right. So even after considerable damage to liver tissue, liver function tests may be normal. So in other words, abnormal liver function tests usually indicate extensive damage. So abnormal LFTs indicate extensive damage. Usually. LFTs are a misnomer, as most of these tests in the panel do not measure synthetic functions of the liver but rather measure damage to hepatocytes. So liver function tests, right? They do not measure synthetic functions of the liver but rather measure damage. So they measure damage, not synthetic functions, hence a misnomer. Right? Okay. Now why we are doing these LFTs? So the clinical significances, we need to know these before going to the actual tests, right? Clinical significances of doing LFTs, right? So first, to diagnose alcoholic liver disease, right? Here in short I am saying that AST is to ALT will be in the ratio of 2:1. These patients will also have elevated levels of gamma glutamyl transferase, or GGT or gamma GT, whatever, and AST will also be elevated here, right? Drug induced liver disease. Some medications like NSAIDs, anti-tuberculosis medications, statins, antibiotics like tetracyclines, okay, antidepressants, antifungals, these are known to cause liver damage when used for long periods. Okay, and this damage can again be of two types. They can be acute hepatocellular damage as well as acute cholestatic liver damage. Okay, so third kind of why we are doing these LFTs are to catch hold of some infections which are causing liver disease, right? Infections causing liver disease, what comes to our head? Obviously viral hepatitis, right? Viral hepatitis. HIV virus can cause liver disease. Cytomegalovirus, Epstein Barr virus, right? And this viral hepatitis B, C, D can cause, hepatitis B, C and D can cause chronic hepatitis, while hepatitis A and E cause acute viral hepatitis. So B, C, D chronic, A, E acute, C for chronic, C, A for acute, A. Okay. Next we move on to liver disease due to autoimmune disorders, right? So liver disease due to autoimmune disorders. Basically patients develop autoantibodies, specifically anti-liver antibodies and antibodies to the liver antigen. So in short, I can write anti-liver antibodies. That's it. Okay. Last one is fatty liver disease. Okay, this is also known as non-alcoholic steatohepatitis. Okay, this is known to cause chronic liver disease as well as hepatocellular carcinoma. So this can cause chronic liver disease as well as hepatocellular carcinoma, right? The liver enzymes, mainly the AST and ALT, are elevated in the ratio of 1:1, while AST and ALT elevated in the ratio of 1:1, while other LFTs are normal. Okay, other LFTs are normal. So now what are the enzymes which are elevated due to hepatocyte damage? Okay, hepatocyte damage, that is liver cell damage. The aminotransferases will be elevated. AST, ALT will be elevated, right? If there is cholestasis, alkaline phosphatase, GGT will be elevated. Okay. Now AST is found in many other tissues like your heart, cardiac tissue, smooth muscles, skeletal muscles, brain, kidney. So AST is found in the cytoplasm and mitochondria. So ALT levels indicate very specific liver injury, that is ALT is present only in the liver, right? So it indicates specific liver injury, AST not. So ALT I can say specific to liver injury or unique to liver injury. You can say specific to liver disease. Okay. This is done. Now let's talk about the tests, right? One by one. Let's draw a column in the next page and okay. So first test, serum bilirubin. If it's greater than 2 milligrams per deciliter, it indicates what? It indicates clinical jaundice, right? Then next one, urinary bilirubin. Presence of deep yellow soluble bilirubin, that is bilirubin glucuronide in urine, indicates presence of obstructive jaundice. So if it is conjugated, then we can say it is obstructive jaundice, right? Again, if there is jaundice, we do the general examination, we see there's jaundice, and if there's absence of bilirubin in urine, this indicates presence of unconjugated, therefore it will be hemolytic jaundice. So if this is present, then obstructive jaundice, and if this is absent, then it will be hemolytic jaundice. It's a revision video, so I am mentioning all the tests at a go. Read books if you want detailed explanation. Do it yourself, okay? It's easy, nothing difficult. Third, it's urinary urobilinogen. If it's absent or if it's normal. Complete absence is suggestive of obstructive jaundice. Okay. Hemolytic jaundice, urinary urobilinogen will be above normal. So yeah, oh sorry, above normal, I wrote normal, above normal. Okay. Next we have serum proteins. Serum proteins like albumin, if it's decreased, it's suggestive of a liver disease. Okay. If liver disease exists, the albumin levels will decrease along with derangement of other liver function tests. Okay. But if LFTs are normal and albumin levels are still low, there might be other causes like what? Low protein, so low or decreased intake of protein due to malnutrition, or protein loss due to kidney disease, right? So these things can happen. Liver disease, okay. Globulin will be normal, but because globulin is partly I should say synthesized in the liver, so serum globulin is not much decreased, so I should say the AG ratio, albumin globulin ratio, is reversed. normal is 1.7 is to 1. Okay. Next test I can say is prothrombin time, right? Prothrombin time, it requires obviously factors 2, 5, 7 and 10 which are synthesized by the liver. Normal it's 10 to 14 seconds, but it will be prolonged in liver disease. Okay. Now next move on to um, thymol turbidity test. It depends upon the normal albumin globulin ratio. Okay, in abnormal liver function the AG ratio is abnormal and this test is positive. Test positive in, I can say, liver disease. Okay, next test we shall talk about is bromsulfaline excretion test. Okay, excretion test. This bromsulfaline is a dye, right? We inject 5 milligrams per kilograms of this dye intravenously into the subject, right? A normal liver usually excretes 95% of the dye in 45 minutes. If more than 10 to 15% of the dye remains in the body even after 45 minutes, liver function is abnormal. Okay, so if still dye remains, 10 to 15% of dye remains, in the body, we can say it's suggestive of a liver disease. Okay, next let us talk about what? The enzymes, right? Serum enzymes. Alkaline phosphatase, as said before, if it increases, it's suggestive of obstructive jaundice. I'm writing just OBS-J, okay? OBS and gynae, sorry, obstructive jaundice. And if ALT and AST are increasing, like greater than 40 international units per ml, then it's suggestive of hepatocellular jaundice. Okay, next there are few more tests like oral cholecystography, right? What we do is we give oral tablets of radio-opaque dye like iopanoic acid, and these are ingested by the patient on the night before. Okay, next morning X-ray of the liver and gallbladder shows the concentrated dye outlining the shape of the gallbladder in normally functioning liver and gallbladder. If the gallbladder shadow is absent, then that indicates non-functioning gallbladder. So here, if gallbladder shadow is absent, then that indicates non-functioning gallbladder. Okay, non-functioning gallbladder. And if there are some filling defects, presence of some filling defects, then that indicates radiolucent gallstones. What is the normal finding? Normal finding is the next morning we do X-ray of GB and liver, we get, or it shows concentrated dye outlining the gallbladder. Okay. Fatty meal given to patient reveals the contractile function of the gallbladder. We give a fatty meal and we see how the gallbladder is, contracting. Next test is glucose tolerance test. Obviously liver is a glucostat, right? Glucose tolerance test. Glucose tolerance test, if it's abnormal, then there's a liver disease. Okay, if it's abnormal, then liver disease. Then we have galactose tolerance test. Galactose is generally metabolized in the liver and there is no rise in blood galactose even after ingestion, right? This is in normal liver. But if galactose is no longer metabolized in the liver, its blood level rises. That indicates abnormal liver function. So you can say galactose tolerance test. Yeah, if it's abnormal, again that means its level rises in the blood, it's indicative of a liver disease, right? Let's talk about some few tests here and there. Ultrasonography of liver and gallbladder, liver scan, then percutaneous transhepatic cholangiography, some funky names, percutaneous transhepatic cholangiography. These are also used to assess liver function. Okay, so these are the tests, and this was a brief summary of the liver function tests. Thanks for watching.